Miss Plath scored a 28. So that just gives you an idea of where she is at in her illness, and it's pretty severe if she has those kinds of scores. So I want to immediately start to treat her, and I think once we kind of get her on a schedule, definitely we want to treat her symptoms of suicide and her suicidal thoughts, and maybe her depressive symptoms, and maybe get her on some sort of medication and have her rest as well, since she's told me that she's been very productive in writing poems, but that she hasn't slept or ate. So we definitely want to address that as well. I would like to clinically admit her to a facility that treats persons that are suffering from bipolar depression and also suicide. And I think once we get her, on the right path, and rested and able to think more clearly, then I think we can, we can talk. We meaning Mr. Hughes, Miss Plath, and I, we can start to address them as a couple. But I think for right now, the focus should definitely be on Miss Plath and how to get rid of her suicidal thoughts and also her depressive symptoms as well. So how do we do that? I would rule out Miss Plath having not anything normal, or rather, let me rephrase that, not anything major like anxiety disorder. I wouldn't say that her anxiety, if you will, is not unwarranted given what's happening in her life. I think that her anxiousness is normal, or maybe her insecurity is normal, in the fact that they're both pretty celebrated people in their own right. I think her husband was attracting attention that made her feel uncomfortable, and maybe she felt as if her husband wasn't being supportive in her feelings. So obviously she was at a heightened state of awareness and sensitivity and not necessarily reflection, but just looking at herself in a different light, like her self-worth and her self-image, if you will. So I don't think that her husband was very understanding of how she felt about him getting so much attention from these young women on the college. So I don't think that her anxiousness would warrant a diagnosis, and so that's why I said that's why I would rule out her having an anxiety disorder. There was also another obsessive compulsive disorder. I don't think obsessive compulsive disorder, just simply because I don't think that she has to perform an act of, here, let me give you the clinical term of that. Excuse me. I was a lot more prepared. I don't know where I did with my paper, but she doesn't have, it's not something that she fears. Her husband's, how would I put that? Like her husband's infidelity. Obviously, that was something that she took very serious. but I don't think it was such a fear that she had to perform certain tasks in order to kind of gain a sense of normalcy in her life. For instance, let me just give you an example. I don't know if I explained that correctly, but um, an obsession is like this thought. It's kind of the anticipation of something that's going to occur. So in order to sort of make yourself feel better about it, you perform the compulsion, which would be like in some people's case, like they have to check the door like 30 times in order for them to really sort of say it, that feeling of fear. And I don't think that she went through anything like that. I mean, obviously, I think that before her husband revealed that he had an affair, I think that it was always sure in the back of her mind, because he was gaining so much attention. But I don't think that she was performing anything or doing anything that was making herself feel better. I don't know if I really, you know what I mean? She wasn't at that particular time writing poem upon poem to kind of make herself feel better. I think she busied herself with her children and that, but I don't think that she took on any sort of compulsion. I think that she had maybe an inside fear that her husband would leave her because she would say, don't leave me or something like that, something to that effect. But it wasn't like every day, all day. She didn't perform repetitive tasks that would make her feel any better about the situation. So I would rule out obsessive compulsive disorder. Depressive symptoms and disorder, I would definitely say that she experienced a lot of that. And I actually composed I call it the Sylvia Plath progression of psychosis. And started with number 1. I said the traumatic death of her father triggered and caused acute distress disorder, with possible separation anxiety. The reason why I said that is just that acute would be lasting no more than a few months, and then no more than 6 months. So she's not able to really tell me how long that lasted, but her depressive symptoms lasted. But she told me that she was like very down in the dumps, and just it would be certain things that would trigger the memory of her father, maybe him not being home, him not seeing or her not seeing his coat hanging, that sort of thing. The separation anxiety, I think, and the needs for attention from caregivers and like her mom and others alike, spawned her wanting to be, surrounded and wanted to be in school, and just kind of away from the memory that her father, had passed on. So I think she had developed a closeness with her mom, so that she wouldn't have to think about the relationship that she didn't have with her father. So that was the first kind of the launching pad, let's say, of the cycle of psychosis. The rejection of the admired poet, and the attempted rape of an acquaintance, and the rejection at Harvard spawned adjustment disorder, I would say. And that's a development of emotional or behavioral symptoms in response to an identifiable stressor, and she had three, occurring within 3 months of the onset of the stressor. So, yeah, a lot of those things happen within weeks to months of each other. Market distress that is disproportionate to the severity or intensity of the stressor, lack of sleep, lack of life support, self-identity, self-confidence, significant impairment in social, occupational, or other areas of functioning. I said like the lack of sleep, the lack of her life's purpose, meaning like her self-identity, her self-confidence, and I think she was really kind of worried like what she would do after college because, I would tell anybody within college you have, obviously you have freedom, more so than say in high school where, you're going to class, you're going to your different teachers, you kind of know what you're doing. And in college, yes, you're expected to go to class and that, but it's the environment is so different. Obviously college, is a lot bigger than high school. You have more kind of free reign of your own life, and especially if you go away to college, you don't have your parent, or whoever is responsible for you telling you when to get up, what to do, what to wear. There's a lot of freedom, and I think sometimes the freedom can sort of backfire. And I think for Miss Plath, I think she for so long had been, academically inclined and certainly celebrated with her art and her writings, and I think that was a sense of normalcy for her. But then after college, it's kind of like, well, what do I do afterwards? So I think she felt very anxious about that. I think she felt very insecure about her abilities as a writer, as well. So I would say adjustment disorder for sure, with that portion of her life. Also, adjustment disorders are associated with an increased risk of suicide, ideation, attempts, or complete suicide. And during that time, she had 2 instances of attempted suicide. So I really think that adjustment disorder, was really an accurate diagnosis of her during that time, or would have been rather an accurate diagnosis of her during that time. So the third progression of her psychosis would be a depressive diagnosis due to another medical condition, and that medical condition being the adjustment disorder, because she was having a lot of mixed features within those depressive symptoms. She was having obviously the depressive symptoms of being sad, being distraught, lonely, blue for long periods of times. But the mixed features come in when she was having like symptoms of mania, or rather hypomania. They were also present, but they didn't take over her overall depressive symptoms. So the hypomania she was doing, or she was presenting, was she wrote the bell jar. She moved. I think she moved like twice. She had the miscarriage, but then she had a live pregnancy with her first child, and then she had a miscarriage with the second one. And I think she wrote another set of poems, like 20 poems at that time after the miscarriage. So Definitely symptoms of hypomania. Then the next progression of her illness what I would say bipolar, for sure, disorder. Um, I think she spent more time being depressed. This was, after the revelation of her husband having an affair, and having an affair so close to home, if you will. Um, she definitely showed signs of hypomania, with her not sleeping, not eating, and being so highly productive in her poem writing that at this time she wrote a set of like 50 or 60 poems. They say also with bipolar disorder, milder forms of mood elevation and milder forms of hypomania that alternate between severe depression. So yes, I can agree with that. Again, she showed the hypomanic symptoms, but she also was more so down in the dumps, and depressed about what was going on, and also her living situation. I don't think really helped what she was already going through internally, with it being severely and bitterly cold within her home. I don't think that she had a lot of light. It was like a really small, it was a really small apartment. And also, so she was looking after two small children, one of which that cried a lot because he was ill a lot. So I think that she went through a lot of phases of her mental illness that ultimately would lead her to a diagnosis of bipolar disorder, for sure. And so my treatment plan for her is fourfold. We were asked to discuss a psychopharmacological treatment plan for her, also a psychological treatment plan, what would be best, a family therapy treatment based plan, and also a biomedical treatment plan. So, from a psychological treatment plan, cognitive